The adverse effects of vaping are far-reaching, with mouth and dental issues alarmingly similar to those caused by illicit drugs.
So we're seeing patients who have not either had gum disease or problems in the past show up with things like gum swelling, pain, ulceration, and even infection, either in an acute or chronic effect. Now, the acute effects often come on very, very quickly. It can be within days or weeks, and suddenly patients can have lots of pain, lots of bleeding, potentially even pus.
Research shows that vaping for just 6 months does the same amount of damage to your mouth as smoking for 5 years, and Dr. Dilhan has seen the fallout.
One of the cases that we've seen is in a relatively young patient. She's in her early 20s and essentially had a relatively healthy mouth, and through vape use, it's dehydrated very, very quickly. Now, she's presented a few times with lots of swelling, lots of bleeding, ulceration, and even loss of the gum that supports her teeth. And you can imagine for a young patient, that's really, really scary and confronting.
The culprit? A cocktail of up to 200 chemicals. Propylene glycol and glycerol, common in vape liquids, dry out the mouth, reducing saliva production essential for oral health.
Saliva is our protective mechanism in the mouth. It provides nutrients, it cleans our teeth, but it also stops cavities and problems from happening. Now, with vaping and things like cigarettes and sometimes illicit drugs, it dries out the mouth, and our natural protective mechanisms aren't there to prevent our problems from developing. We're having dry mouth or xerostomia, which causes the salival flow to be weaker, and that can cause either gum inflammation, swelling, or pain. And with the teeth, we can see an increased risk of things like dental cavities or even sensitivity and pain. And then I'll just protect it a little bit better.
In addition to severe oral damage, new conditions are also emerging, like vapor's tongue.
Normally, we've got good and bad bacteria in our mouth. With vaping, the saliva in our mouth degrades, it's less viscous, and that can cause different types of bacteria to thrive. The more use of vapes can actually desensitize or change the oral environment inside the mouth, and this can cause an altered sensation for the patient's tongue.
In other words, you can lose your sense of taste. The vape juice coats the tongue so the taste buds don't get the flavour signals.
Information education is critical. The more that patients and people know about the effects of vapes, the more that we can understand how that can damage our oral hygiene and oral health.